Hi there, and welcome back to another COVID-19 update with Dr. Manfred, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership, hosted, of course, by the American Society of the University of Haifa. We're doing a slightly different format this time around to previous weeks and giving you some behind-the-scenes insight into COVID-related research that is currently taking place at the University of Haifa. Dr. Green, it's an honor to once again have you join us. Now, we've touched on this in the past, but you were one of the university's 18 faculty members who were awarded funding from the Israeli Ministry of Science and Technology to draft coronavirus-related research proposals that the government is partially subsidizing amid the pandemic. So without further ado, I'm going to open up the floor to yourself to talk us through this process in general, the research that you've been undertaking, and any updates that you can provide us on your progress.
Thanks very much, James. I must say in the outset that I'm going to talk very generally because I haven't really organized the presentation to talk specifically about any research, but I'll touch on different points and give you some ideas of what's being done, what should be done, and what we are trying to do to contribute to the research. So basically, the big research questions that are being asked, obviously, are how does the virus cause illness, what treatment works, how do we develop a vaccine? And then we get on to other issues that seem to be almost issues that should have been known a long time ago, but do the masks really work? Does physical distancing work? Do children spread the disease? So there are a huge number of questions that arise during the pandemic, and this is not unusual because it's a new disease. So we really cover the whole spectrum of what could be researched in order that we could provide better information. So just looking at where we are now, there are about 25 million cases and 850,000 deaths. And it's continuing in the Americas. There are new waves in Europe, and there's a large second wave in Israel, which I thought I'd show you. And this is the second wave in Israel, and you can see that it's much larger than the first wave. There are several reasons for it. Part of it is slightly artifactual. One is that it's much more influenced by young people, children and young people. So the age of the people that are infected is much lower in the second wave than in the first, indicating, I think, that the older people are tending to protect themselves or being protected. The second is that there was, at least for some time, evidence that a lot of people were being tested who were not symptomatic. So that was not really done in the first wave. So there are a lot of asymptomatic people in the second wave. So that second wave you should see within that context, although clearly the virus is still spreading widely, but there are factors that are influencing the size, not necessarily because there's more infection, but because of what is actually happening. So it's a combination of it. But I think the bottom line is there's a lot more infection. And we have to ask ourselves why, and I guess the main reasons, as we can understand now, people are much less inclined to protect themselves and others using masks, social distancing, and so on, and taking part in large gatherings. So this is unfortunately still happening despite the regulations. And you may have heard there's this new program now called the traffic light program, where areas will be divided into red, orange, yellow, and green, and then they will allow privileges or allowed to congregate or allowed more freedom of movement in areas that are green, and some of which are the low incidence groups. So we'll wait and see. One of the topics, though, that we really are interested in research, and some of this is some of the things that I've been involved in and am involved in. The one is the economic impact of the pandemic, and I'm not an economist, but we will certainly be looking at the economic aspects. The economic aspects partly due to the disease and partly due to the efforts to reduce the impact of the disease. The health effects of the pandemic itself. So the health effects will obviously influence the kind of disease you'll be seeing and its impact on the hospitals and so on. Then there's the social impact of the pandemic, where people are going to be more isolated There's going to be much loss of jobs and all the rest of it, which are all going to impact, have a very major social impact. And then we'll be looking at the non-pharmacological interventions, the ones that I mentioned again, how effective are masks, what kind of masks, where should they be worn, how often should they be worn, should they be worn by little children, so on and so forth. And then the pharmacological interventions, which are basically vaccines and medications, in other words, for prevention and for treatment. So these are the areas that we are looking at. So I can already touch on one of the things that we are doing. We have actually submitted a small proposal to try and look at the balance between the economic impact of the pandemic and the health effects. In other words, what is it really costing us to save lives, as it were, or to save illness in terms of the impact on the economy? So all the measures that are being taken, limiting people from congregating, limiting the activities of restaurants, not allowing much tourism, closing the borders and all the rest. These are having a huge economic impact. There are all kinds of measures, 4 or 5 or more % of the GDP. In Israel alone, anything from about $500 million or maybe dollars or shekels a day in terms of the loss to the economy. So these can be very striking economic impacts. And the question is, what is the so-called return in terms of preventing potential illness? So we are looking at some of these issues here, looking at the ways in which we measure the potential impact. And here I want to just make a quick comment about that. I think that it's sometimes confusing to people to understand what is meant by saying what the potential impact of the pandemic can be and what the actual impact is. Now, when we talk about the potential one, we say, well, if there's no intervention and the disease spreads very widely as it could, and it actually is as dangerous, particularly in elderly people and people with chronic conditions, as we believe it to be as a result of the data that we've received from other countries, then you would get very large numbers. So there could be predictions that there could be anything up to 30,000, 40,000 deaths in Israel. So, and then multiplied out, if you wanted to, in the economy, in the United States, just multiply that by 40 or so, and you'll get to figures like 1 million deaths. You have to remember that those estimates are not estimates of what will happen or what is believed will happen. It's what could potentially happen if, in fact, no action was taken. So the fact that we're seeing much less of that at the moment is not because the predictions were wrong, but because there has been intervention. And we know that the intervention has to a large extent been very effective. And funnily enough, the reason why we know that it's been very effective in many respects, or at least it seems to be, we do have one measure in addition to the measure of the actual disease, and that is of influenza. We've almost eliminated influenza. Influenza, which should be very common in the Southern Hemisphere right now, is almost non-existent. They're virtually not isolating. And that was already seen at the tail end of winter or the influenza season in Hong Kong. So what has happened is that we believe that the impact of the masking and the social distancing or physical distancing and so on, and the lack of travel has certainly had an impact. It's been very expensive, particularly the closing of borders and so on. But it certainly had an impact on diseases that are transmitted, respiratory diseases, viruses that are transmitted from person to person through respiratory secretions, coughing and sneezing and so on, and speaking. So that's an area that we're looking at, and we're trying to look at the health effects. So let me tell you a little bit about that. There are obvious health impacts that you might, I've spoken about the economic impact here. So let's go on to the health impact. It's clear that the health impact is the cost of treating patients. So we're very concerned about actually being able, excuse me, to treat patients in hospitals and give them very intensive care. Then there are what we call the cost of years of life lost. And the cost of years of life lost is basically the years of life lost for someone who has died before what we would say is the life expectancy, or at some measure that we would say that these are lives that were lost early in life because of death prior to, shall we say, the life expectancy. So we can multiply that out in the number of people who've died early, so to speak. We can also look at the years of what we call disability adjusted years of life lost, in terms of actually looking at the fact that some people will actually suffer from the illness, but they will have after effects of the illness, and they may actually suffer disability for quite some time. So we have to factor that in. So in fact, the health impact is not only just the disease, it's death, and it's also disability. There's a cost of absenteeism, of people not going to work. And that has to be remembered. Many people who actually, I think, very liberally said, well, let's just let the disease, take its course, and maybe we'll reach what we call the herd immunity. People will then develop immunity and everything will be fine. I don't think people really who spoke about really thought to the end of what exactly would happen if we just allowed the disease to take its course, and huge numbers of people would be sick. They would be sick for a long time. They would be absent from work. So in any event, there would be a huge economic impact. And they may, clearly, of course, we would have a large number of deaths and a large number of people who may have disability for some time. So it's a more complex issue than just saying, people can get an illness, get better, and be immune. That's not quite as simple, particularly in an illness like this, which can be very severe. There's another area that we're looking at, and we are now carrying out a survey in Israel, looking at the failure to use health services for other illnesses, and the failure to carry out recommended screening, and the failure to be immunized. What has happened is that because, I guess, the good message of telling people not to congregate, to practice physical distancing and so on, has given a message to the public that if they are not feeling well, they actually should not go to the hospitals or the clinics, because they may then be exposed to COVID-19. In other words, it's a message that was unintended, but it's a message that's gone through. So people actually are scared. We believe that many people are actually scared to use the health services because they fear that they may be infected. And this seems to be a very real impact, and that obviously will add to the issues of people who will have a more severe illness because they've delayed going to the clinic. I think I might have mentioned it before. There are documented cases now of people delaying going to a clinic or to the hospital when they have severe chest pain, and then they have a heart attack at home with complications, and sometimes they don't actually make it. They actually may die at home. So those are obviously or shall we say, unintentional messages that went through that weren't really intended. So what we're doing now is we're carrying out a survey in the population. The survey's just started now, and we'll be completing it, I guess, in the next few days. It took us some time to develop the survey, and we will have information there to what extent people are not using health services, to what extent they're scared of using them, and to what extent the message has been misunderstood, so that we can tailor better messages to use health services. We know there's been a reduction in the use of health services. So in fact, the impact is already evident. The other area that we are very concerned about is the failure to be immunized. We're worried that people are not going to bring their kids to the clinics to be immunized. And then we'll be faced then with another issue of outbreaks of a disease that could be prevented by immunization, like measles and rubella and whatever. So we are following that very carefully, but we also actually interviewing people about whether they're concerned about going to the clinics, and then to look for ways to actually intervene to make sure that they carry out these essential procedures. This is going to be something that is going to be with us for quite a while. So we have to make sure that in terms of general healthcare, that is not affected by the outbreak. In other words, the outbreak will take some of the health services, and it will use some of the health services at the expense to some extent of the regular one. But that should not delay people from getting what they should be getting real effective care for other diseases and other illnesses. The other one is screening. Of course, we can see that there's a drop in screening for colon cancer and for breast cancer. And that's obviously, as we'll see the impact of that later in terms of not detecting early diseases that could have been detected. The social impact will also be part of our study. We're looking to some extent on that now in a second survey that we'll be carrying out. And that survey we'll be doing in the next 2 weeks. In other words, we complete the first one and then we'll be doing another one. And we'll be looking at the impact of children being out of school. They do go back to school now, but we wanted to see what had happened before then and what will happen in the future if they have to close schools again. The social isolation, particularly of the elderly, how they've been coping with that and to what extent it's impacted on their mental health. That's the lack of social interaction and the lack of social events. Then there's one other issue that I'll talk about very briefly. I was hesitant about putting it in here because it's somewhat technical. So I'll talk about it in a few words and maybe I'll let James and Jen decide if they want me to go into more detail sometime in another session. We are also looking at measures of the severity of the illness. What that means is that we are looking at indices that we use to measure to what extent this disease is as severe as it is and whether it's changing in its severity. So what we're looking at, I'll give just a couple of examples quickly. So let's, for example, say we take the number of cases and we know the number of deaths. If you divide the number of deaths by the number of cases, you would get what you think is a case fatality rate. In other words, how many of the cases or what percentage of the cases died. And I know that's commonly being done now on the internet. People see the number of cases, the number of deaths, and they'll say, well, is it 2%, is it 1%, and so on. Well, obviously the data on the internet that you're getting there is very crude, and it's not really providing a good picture. There are a huge number of biases in those data. So what we are doing basically is we are trying to identify better data sources where we can actually tease out the different components to decide where in fact we can see an impact that measures the severity of the disease, and particularly whether the severity is changing. So for example, and this is maybe the last couple of things I'll say, the first would be whether in fact the medical services or the intervention is actually improving. In other words, are we seeing more survivors, shall we say? And we'll be looking at indices to look at that. We'll be looking to see whether in fact the virus itself is causing more deaths or causing a more severe illness. So we'll be trying to use that data to see whether there's a trend in that form. And we're looking at a third indice as to whether it's impacting on overall mortality. This is another measure that's used. So these are the things that we're also looking at. Obviously, we are not the only ones who are looking at it. We're part of a big society of researchers who are looking at these things, but we have started to look at that, and we've published now a couple of papers, and at some stage I'll give you a reference to the papers that we've published. One which is now I think in process of being published is the difference between the sexes, where men, particularly men, have a higher case fatality rate. In other words, they are more likely to die from the disease. They're not more likely to acquire the disease, it seems, but they're more likely to die if they do. And we are trying to understand why this sex difference exists. So these are the things that are in our kind of research agenda, which we are doing. There's obviously a huge amount of research. I haven't spoken at all about the vaccines and so on, where you can imagine these are very large research programs going on all over the world. So I think that's enough for today. Thanks very much.
Fascinating. Thank you, Dr. Green. And, short answer to what you just said earlier. We'd love to hear more about your research in the coming weeks. So simple answer is yes to that. Dr. Green, thank you so much for sharing your research with us and the research process in general. It really has been so insightful, and we thank you for everything you're doing to help us get through this pandemic.
James, I just will promise either in the next couple of sessions, maybe I'll be able to share some results of the surveys.
Oh, wonderful.
Okay.
That'd be fantastic. Thank you. I mean, look, if there's anyone out there that does have any questions for Dr. Green, and he's already mentioned that he'll be coming back to present some results here. So if anyone does have any questions that they'd like him to get to in our next session, please leave your comments in the comments section of this video, or email them to info@asuh.org. As always, for more information about the university's work around the pandemic and to support the university during this time, please find a link included in this post. Thank you as always for tuning in, and we thank you also for your continued support. Take care, everyone.